I think it's a symbolic coincidence that this year we will have the first International Day of Patient Safety, and it's in the same year as we celebrate our 10th anniversary of the Institute of Patient Safety at the Universitätsklinikum Bonn.
When we're talking about patient safety and when we're talking about improving patient safety culture in healthcare organizations, we're talking about changing how people think and what people value and what people believe to be true regarding patient safety. And obviously this change is extremely difficult, and probably understanding what people think, believe is a good place to start.
In preventing errors, we have to look at organizational factors and at the system, and we have to develop measures in creating safer systems. One major point in some of our projects is international collaboration. So what we can do when learning about system change is looking at other systems. So we're looking at the healthcare systems, for example, in Australia or Switzerland or Georgia. So by comparing the systems and by comparing best practices, we can learn from each other.
When we are looking at a construct in one environment, one hospital, let's say, we're looking how the things are. But when we're looking at multiple hospitals, and when we're looking at multiple hospitals in different cultures, then we see different possibilities. Let me tell you about our Georgian project. We developed methodology, how to collect the data. We went to Georgia, obviously. We contacted local hospitals, larger ones, and most of them agreed to participate. Then we trained local representatives of the hospitals, quality managers, clinical managers, who can in future conduct these studies on their own. We collected all the questionnaires later and prepared reports for management of each hospital separately. We discussed these reports and their implications and possible ways to use them in future with local study coordinators, and encourage them to use safety climate surveys in future. One of the greatest strengths of patient safety culture surveys is that they are relatively easy to implement on the hospital level. And these questionnaires provide valuable information for managers and for researchers.
Safety culture on all levels, I think, means that we have to look at individuals, and we have to look at organizations, and we have to look at healthcare systems at the third level. And when looking at individuals, we have to address patients and healthcare professionals, we have to address leadership and management, and we have to look at citizens, at the society and at politicians. It's about changing beliefs, changing attitudes towards sharing experiences.